This segment of the news is brought to you by Sun Oil Limited.
Hopes dashed at the crux of the Consultants Physicians Staff Association standoff is an unacceptable agreement. And at this point, CPSA President Dr. Loxley Monroe is holding firm that the association's withdrawal of services will continue until that agreement is acceptable. That's what the senior physician shared with our news team soon after coming out of a meeting with the Prime Minister and the Financial Secretary.
Some positive progress has been made. Primarily, he's now organized for a meeting to take place between the CPSA, the Financial Secretary, and someone from Ministry of Finance. And that meeting is to take place as a matter of priority. And it is hoped that at the end of that meeting, we should have a mutually acceptable agreement signed off on.
Now, the CPSA is nearing a week of industrial action that has forced Public Hospitals Authority officials to activate an emergency operations center at the Princess Margaret Hospital. The union's issues date back years. Concerns vary from working conditions to salary increases to a lack of health insurance. Meantime, the Governor General paying a visit on the Princess Margaret Hospital, where she toured the newly renovated 24-bed Corey Newbold ward. Those renovations include new flooring, a new AC system with cross ventilation and airflow exchange, new installed pipe gases at each bed station, and a nursing call bell system at each bedside. The new ward also features 2 isolation rooms, access to the new digital imaging and laboratory systems, along with a complete resourced nurses station, staff lounge, and consultation and examination room.
Today, as you have seen, all of the renovation works have been completed and the ward has been officially reopened to patients following a brief blessing and commissioning ceremony on Wednesday of last week. I am also pleased to report that the initial phase of the PMH Radiology Department upgrade has been completed, and this too has been brought into commission. This important undertaking has resulted in a dramatic technological leap in diagnostic imaging and health information management in our public health care system.
Dr. Sand says the renovation of key areas has taken the radiology system to a new level.
Just recently, a live demonstration for the media had radiology teams stationed at PMH and the Rand Memorial Hospital, and these images were simultaneously accessed and conferred around the country via the PACS system in real time. This was a red letter day for the department, and as a physician, I can tell you that it brought me immense joy to see this standard of service delivered at an institution where I have spent so many years working.
A veteran public servant weighs in on the wave of labor unrest hitting the country. As far as Luther Smith sees things, many unionists do not understand the system in which they are working. Furthermore, there's just not enough stringent demand from senior members and others to insist on certain things.
The point is, I think the bureaucracy has gotten too large. It's ungovernable. And one of the suggestions about public sector reform, as I said earlier, shouldn't just be window dressing. You have to be serious about it. The public service is large because we have made it large. 50% of the people on the public service roll, or certainly I would say about 40%, can easily be siphoned off into local government entities. If you were to add the entire public service role of the United Kingdom, well, that's too drastic. But let's go to a small country like New Zealand, which I visited. If you had to take the entire public service role of New Zealand, it will probably be large as well for a country of about 3 to 4 million people. But the people who perform certain functions, daily functions, are not within the public service per se. They are in local government, they work for the shires, they work for the counties, they work for the city, they work for other entities.
Mr. Smith has served as permanent secretary in several ministries. He's also served outside the Bahamas as a high commissioner and most recently Director General of Bahamas Information Services. His comments came while appearing as a guest on Love 97's weekly talk show, Jones and Company. We're now 2 days into the Nassau Grouper season being closed. That's a reminder that it's illegal to land, purchase, or sell the popular fish from now on until February 28th. Environmentalists continuously stress that this gives the grouper a little privacy time to reproduce. Those found breaking the law could face a hefty fine or imprisonment. In the meantime, fish lovers are invited to enjoy the predatory lionfish. Our final story is up next.
This segment of the news has been brought to you by Sun Oil Limited.